Stop scrolling for a moment because there is something important happening around hantavirus right now, but it may not be what fear-based headlines are making you believe. Yes, hantavirus is real. Yes, it can become serious. And yes, every adult, especially people over 60, should understand how it spreads and what warning signs to watch for. But here is the part most people are missing. Hantavirus is not something you catch by walking past another person at the grocery store. It is not spreading through communities like a seasonal cold. And for most people, the real solution is not panic. It is simple awareness, smart prevention, and knowing exactly when to take symptoms seriously. Today, I want to explain what hantavirus actually is, how rare it usually is, why most people do not need to live in fear, and what practical steps can reduce your risk dramatically. Because the goal here is not to scare you. The goal is to help you stay calm, informed, and protected. Before we go deeper, I want to ask you something. Have you recently cleaned a garage, shed, attic, cabin, barn, basement, or any place where mice may have been present? And how old are you? Drop your age and your answer in the comments, because this is exactly the kind of situation where awareness matters. Now let's clear up the first big misunderstanding. Hantavirus is mainly linked to rodents, especially deer mice in North America. The virus can be found in rodent urine, droppings, and saliva. The biggest risk usually happens when old contaminated dust gets stirred into the air and someone breathes it in. That means the risk is usually connected to specific environments: closed cabins, storage sheds, old barns, garages, crawl spaces, places where rodents have been living quietly for weeks or months. This is very different from the kind of virus that spreads easily from person to person in everyday life. And that difference matters. Because when people hear the word deadly virus, they imagine something everywhere, invisible, and impossible to avoid. But hantavirus is not usually like that. It has a pattern. It has known risk situations. And when you understand those situations, you can protect yourself without panic. Now, does that mean you should ignore it? Absolutely not. But it does mean you should respond intelligently instead of emotionally. The first thing doctors want people to understand is this: do not dry sweep rodent droppings. That is one of the biggest mistakes people make. They walk into a dusty shed, see mouse droppings, grab a broom, and start sweeping. That can push particles into the air. If virus particles are present, that is exactly the kind of exposure you want to avoid. Instead, the safer approach is simple. Open doors and windows first. Let the space air out. Wear gloves. Use a proper mask if there is visible rodent activity. Wet the droppings with disinfectant before cleaning. Then wipe them up carefully and dispose of them safely. This is not complicated, but it does require patience. And that is the message most people need to hear. Prevention is not dramatic. It is practical. Now let's talk about symptoms, because this is where balance matters. Most people who get a fever, body aches, or tiredness do not have hantavirus. Those symptoms can come from many common illnesses. But if you recently had possible rodent exposure and then develop fever, deep muscle aches, unusual fatigue, dizziness, stomach symptoms, or shortness of breath, you should not guess. That is when you tell a doctor clearly, "I may have been exposed to rodents." That sentence matters, because doctors cannot always connect the dots unless you give them the missing piece. The dangerous form of hantavirus can affect the lungs, and breathing symptoms should always be taken seriously. But again, the point is not to assume the worst. The point is to act early, explain your exposure, and let medical professionals evaluate you properly. This is where calm awareness saves more people than fear ever could. Now, if you are over 60, you may be wondering, should I be more worried? Here is the honest answer. Older adults should be more careful, but not more panicked. As we age, the immune system changes. Lung reserve can be lower. Recovery from serious infections can take longer. So yes, prevention matters more. But that does not mean you should be afraid of every garage, every garden, or every storage box. It means you should use common sense. Do not clean rodent-contaminated spaces without protection. Do not sweep dry droppings. Do not ignore symptoms after exposure. And do not wait too long if breathing becomes difficult. That is the balanced approach. Now let's walk through 5 calm, practical steps every adult can use. Number 5. Check high-risk spaces before cleaning. Before moving boxes, opening old drawers, or sweeping corners, look for signs of mice, droppings, nesting material, chewed packaging, musty odor, or greasy marks along walls. If you see signs, stop. Ventilate first. Protect yourself. Clean the right way. Number 4. Seal entry points. Rodents usually enter through small gaps around doors, vents, pipes, garage corners, and foundation cracks. A mouse can squeeze through a very small opening. So prevention starts with blocking access. Seal gaps. Store food in closed containers. Keep pet food covered. Remove clutter. Trim vegetation near buildings. This does not just reduce hantavirus risk, it reduces many rodent-related problems. Number 3. Clean safely, not aggressively. Never dry sweep. Never use a leaf blower. Never vacuum droppings with a regular household vacuum. Wet first, disinfect. Wait, wipe, bag carefully. That simple order can lower risk dramatically. Number 2. Know when symptoms matter. Fever alone does not mean hantavirus. But fever plus recent rodent exposure plus worsening breathing is different. That combination deserves medical attention. And number 1, do not let online fear control your decisions. This may be the most important point in the entire video. Fear makes people do strange things. They avoid normal life. They panic over every symptom. They believe every dramatic headline. Or they do the opposite. They shut down and ignore real precautions because the information feels too overwhelming. Neither extreme helps. The safest people are not the most scared people. The safest people are the most informed people. They know the risk. They know the warning signs. They know how to clean correctly. And they know when to call a doctor. That is exactly where you want to be. So here's the final takeaway. Hantavirus is serious, but it is not a reason to panic. It is a reason to respect rodent exposure, clean carefully, protect your lungs, and act quickly if symptoms appear after a known exposure. Most people will never encounter it, but the people who do need to recognize the risk early. That is why this conversation matters. Not because you should be afraid, because once you understand the truth, you can stop guessing, stop panicking, and start protecting yourself the right way.